In addition to COVID-19 and the flu, something else for parents of young children to worry about. It's called RSV.
RSV, it's a respiratory virus that is in fact pretty common, but it's hitting earlier this year and in bigger numbers. Crown 4's Dan Kerman spoke to experts today to find out why.
Both UCSF Benioff Children's Hospital in Oakland and Packard Children's Hospital at Stanford are seeing something unusual this year, an October surge in the respiratory virus RSV.
In children, especially young children, and by young children I mean under the age of 2 and certainly under the age of 1, is that RSV has a predilection to go into the chest. So it causes a lot of mucus and inflammation in the chest. It can cause a pretty nasty cough and a cough that can last a long time.
Doctors say typically the most severe cases are in infants, but now they're seeing it in older children.
So it was a little surprising to have all of these 2-year-olds, but these are all what we call these pandemic babies. So there are young kids that weren't exposed to a lot of viruses in their first 2 years because they were at home, they were trying to avoid group situations, they were in preschool pods, things like that. And I think this is the first time they're seeing a lot of these winter viruses. And so they don't have antibodies to them. They don't have the natural defenses to get over the colds as easily as you would expect for a normal 2-year-old.
Doctors say most children who get RSV do not need to be hospitalized, and there are ways to avoid getting it.
To mitigate the likelihood of infection, people can undertake really good hand washing and make sure that you're not interacting with people that have upper respiratory tract infections.
Doctors say this surge in RSV cases will likely continue through the winter months, which is why parents should see that their kids are as protected as possible.
While there are no vaccines for RSV bronchiolitis, there are vaccines for 2 other respiratory viral pathogens that are quite common currently. One is COVID-19 and the other is influenza. And giving your child those vaccines will significantly mitigate the risk across the course of the entire winter.
Dan Kerman, Crown 4 News.